You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you are considering any type of facial plastic surgery. With us, we have an expert on the topic, board-certified facial plastic surgeon, Dr. Machida. Dr. Machida, welcome to the program.
Thank you, Randy. It's a pleasure to be here.
Now, we are going, I know you brought some of the photos, so we're gonna show those. And for people tuning in, I mean, these are pretty dramatic photos. Who is your typical patient that's coming in to get some facial plastic surgery?
Well, I'd say the typical patient is a woman in their 40s to 50s. They come from all very walks of life. They could be school teachers, police officers, even contractors, construction workers. I even had a roofing contractor come in, and it's becoming more and more mainstream. Of course, we see people in their 60s, 70s, and 80s too as well. And these people sometimes are going through a life change. They've gone through a divorce. They have a special event coming up, like a daughter's wedding, but they just want to look better.
Okay, now you're known for natural results. One of the nice things, and we invite you on the program, is because you've done over 3,000, more than 3,000 facelifts.
Thank you very much. Actually, I've done quite a few, and if you look at the numbers, probably it's more than most would do in their whole lifetime.
And so even currently you say about 5 or 6 facelifts a week?
About there, yes.
So it's all ages now. Are they getting younger and younger, or are they getting older and older that are getting this done?
Well, it's a wide variety. As I said before, I've done people as young as their 30s, late 30s, and as old as even 90. So it's such a wide range of people, it's hard to keep track. But the average is about maybe 40s, 50s, 60s.
So who's like the ideal candidate, or who should get facial plastic surgery?
Well, no one really needs it. It's just a matter of whether it bothers you or not. And that's such an individual decision. Typically, the ideal candidate is someone who has heavy jowls on their cheeks, or a heavy neck, or wrinkled neck, or loose skin. There's a wide variety of reasons why people might need to have it done.
Now, you say for many of these patients, it is life-changing.
Well, Randy, it's definitely life-changing. You know, people who all of a sudden go from someone who is old to looking young, or looking from a mother to looking like a sister, they get happier, they get more confident, they feel better about themselves. And the whole purpose of my practice is to help them feel happy about themselves.
Are there a lot of people that actually hate the way they look, like hate the way they're aging? Because I mean, you hear the stories, obviously, on these consults.
I'm not sure that I'd use the word hate. That's a very strong word.
Okay.
But I'd say there's a definite unhappiness about who they are, and they feel like they're not looking as good as they can. They feel like they're not confident in themselves, not pretty enough. And our goal is to help them look like how they feel, because they feel a certain way, but they feel like they look a certain way, and it's just not consistent with how they look. And our goal is to get them close to how they were created. By the way, that's the name of our practice. It's called Second to Creation. We believe that people were created with an innate inner beauty that they have, an outward beauty that they were born with, and all of a sudden they get older. So we want to recreate them, restore them, second to creation, because we can't be as good as God, but we can get close.
You told me that on the phone. Only God can do it better.
That's right.
That's the name of your practice, which is your tagline.
We're second to creation.
Second to creation.
That's right.
So how many years, by the way? So a woman, like 55 years old, comes in. How much younger can you make them look?
Well, we did have a couple of cases. Women in their 50s, after they had our procedure done, they got carded. One woman, she told me this story. She had a procedure done. She was with a girlfriend in a bar, and the waiter asked her for her ID, and she was so shocked. She gave it to her, and she was so happy. In fact, that happened twice to her. In this particular case, she was thrilled that she got asked her ID, and her friend that was with her, her girlfriend, said, "Do you want to see my ID too?" And the guy said, "No," which was kind of cold, but she was just thrilled about that.
So to take 10 years, 15 years off an appearance is
10 years,
every week for you?
10 years is a pretty regular occurrence, I'd say. And I'd say 10 to 20 years is doable. More than that, it's got to be a real perfect kind of case. Back to your original question, on time of the consult, these women come in and they're not confident about themselves. They think they're not pretty. They think that they need to stay inside because they're shy about themselves. They're shy about how they look. They're self-conscious. And it's amazing. After it's all done, they're out, going out, they're enjoying life, They're feeling better about themselves. They're feeling more confident. They're meeting more people. In fact, I had one woman who just had a divorce and thought she wasn't pretty enough. And so she wasn't going out. And after the procedure, she comes back into the office and she's all of a sudden wearing these real nice clothes, and I see hickeys on her neck. She's got hickeys on her neck.
Is that right?
Yeah, it's just incredible.
So I guess when people feel better about themselves, it changes.
Definitely changes
everything. Okay, you brought some photos. What are we looking at here?
This first one is a woman who came in with, if you look at her neck, you can see her neck. She's got some wrinkles, she's got some loose muscles, some jowls, and she's got some lines on the sides of her face that shows just typical aging in a woman. Well, women like this, they come in for their consult, and there's certain things they don't like. They don't like the lines on their neck, they don't like the looseness of their skin, they don't like the wrinkles that they see in their cheeks, the heaviness of their jowls. You can see it on their picture. If you look at her neck, see all those things that I'm talking about. Our neck
And that's
our
standard aging,
jowls.
obviously.
Yes, it's very standard aging.
So she looks like a healthy, attractive person.
Right, but she doesn't like the way she's aging.
Okay.
She feels as if she needs something done about this, and that's why she's here to see me.
So when you do this technically, are you thinking, okay, I need to take care of the neck? And is this considered a full facelift patient?
This is considered a facelift and a neck lift because you have to address the neck too as well. In some cases, some doctors don't really address the neck very well. And here's an example of her after the procedure is done.
Very nice.
If you look at her neck, of course, it's all cleaned up. There's less looseness. There's less lines. If you look at the sides of the cheeks, see the wrinkles, they're gone. See how the jawline is a lot tighter?
Wow, very nice.
Yeah. Randy, look at the before. See the cheeks here? See how she has the wrinkles and lines? And look at the after. It's nice and
they
smooth.
are gone.
It's smoothed out. It's incredible.
So this was just with a facelift or some lasering as well?
Well, she did have a laser as well, and I like the combination of using a lift and laser. It's like the finishing touch on top of a lift when you can have it done, especially for these lines, and it works really well. How many years younger do you think she looks? How many?
Well, she definitely looks at least 10 years younger or more.
Well, she definitely thought that she looked a lot younger than that, more like 12 to 15 years younger than the 10 years. So she was very happy with the result. So say, for example, if she was on a job interview and you were able to look at her before and after, who would you hire if you're an interviewer?
So if these were like twin sisters, I mean, obviously if everything was the same, right? Education, the person that looks probably more energetic, fresher, is probably who you hire, with everything being equal.
Right, and
the person with energy.
and that's a bias in society that is just there. It's just there. But I want you to look at the profile.
Okay.
If you can see the profile, just look at the lines in her face. Look at the lines in her face. Look at the side of her neck. See the band there. See
So it's a little bit. Is that a muscle?
That's a loose muscle
out?
there. A loose muscle that's just hanging there. So that needs to be tightened. It needs to be addressed. If she was at a party, that loose neck is a giveaway for her age. And for social events, parties, it makes her look just so much younger. Especially, most women see themselves straight on in a mirror. They don't look at the sides of their neck. But people who see these women in everyday life, they look from the sides. You see their profiles, and that's how they can tell how old they are. That's something you can't see just looking at yourself, but it looks fantastic just taking care of that.
So this is a neck lift, facelift, and
a laser.
Is that what you call it?
Yes, well, you call it a facelift because I always address the neck at the same time. It's routine for me to do both. And she had a laser too at the same time.
Okay, now let's talk about the aging face in general. You're in front of a patient, starting from the top down. What are some of the things you do for the brows, the eyes, and to the neck?
Well, it's important to do a complete evaluation of the whole face. If their brows have fallen, you have to consider lifting the brows with a brow lift. If there's excess skin around their upper eyes, or if they have fat bags on the lower eyelids that need to be addressed, you have to be able to look at that and evaluate that too, as well as looking at the whole face and the neck too. So it's a whole complete package we have to look at. Well, let's go back to talk about the brows and the eyelids. People have heaviness on their eyelids, and it makes them look tired and old. So we want to be able to restore that youth and make them look like more youthful, because sometimes that's the first thing they see is they see the eyelids and how the eyes look. We like to restore that look, not do too much, but just.
So what do you do? You're just removing skin?
Well, what we do is we do take out the excess skin and take away some of the fat that might be there that causes some of the puffiness that you see. And then especially in the lower lids too, that's where they have the puffiness there too, and we like to address that too at the same time. First off, when you address the upper eyelids, you have to make it sure that you're doing just the right amount. It just comes from experience. You can't do too much, because then they
Like
don't
remove too much what?
too much skin, because then they look done. And you want to be able to make sure that you have just the right amount. That just comes from experience. But by doing that, they look so much more youthful. They feel better about how they look. And that's one of the first things that people see is eyelids.
Now the brows. And we've talked a little bit about it in our green room, that super high brows can make somebody look older. Because young people don't have high brows, right?
Right. And that's one of the things that we like to address too, but we have to be very careful, because doing brows for me is something that I consider secondarily or more of a last resort, because I don't like to make the eyebrows too high, because sometimes it looks too unnatural. It makes them look like they're older than they actually are.
Or the high brows.
The high brows.
Because young 18-year-olds don't have high brows.
That's true. They
But a
don't.
woman in her 70s has brows that are way up high.
Right. And that's just a misconception people have. So we like to make sure that we address everything properly.
Okay, now what about hollows under the eyes?
Well, that's an interesting point. Sometimes it's because the fat is in the wrong place. So sometimes they need to have some of the fat taken down a little bit. They might need to have a little bit of a filler put in the trough below the fat. It just depends on what the situation is.
So what about under the eyes, like hollows under the eyes?
Well, Randy, oftentimes if people have hollows under the eyes, they look older. They look more tired. They look drawn out. And a lot of times the way to address these is there's a variety of ways. You can use fillers. Another thing that I like to do is something called fat transfer, using your own fat to fill those hollows under the eyes. So what we do is we actually do a little bit of liposuction on some part of the body, and that's a double advantage, because you're having a little bit of slimming in there that you're liposuctioning, and use that fat to transfer and re-inject into the areas that you need filling, like under the eyes in this area here and here. And that's your own fat. And that's the advantage to it, because it's all natural and it's all yours. And this fat lasts a lot longer, because fillers only have a certain life in the body, and then they're eaten away, they're dissolved by the body. But fat's a lot different. It's your own material. And the other nice thing about fat is that it lasts longer, because it's smoother, it comes in a lot nicer. And one of the problems with fat is that sometimes people overfill. They fill in too much. You have to do it just right, and that comes from experience.
So when I see people that are like overdone, like celebrities or whatever, whose fault is that? Is that what they requested from the doctor or the RN, or is that the doctor that maybe is just overdoing it, doesn't have an eye for beauty? I'm trying to put you on the spot here.
Well, people, when they come in, they just want it better. They don't know exactly what the technique is, and usually it's the injector that is the one that does that. They usually put a little too much in. It just comes with experience. You have to use their experience to put just the right amount in to make it look good. And that just comes from people who do it a lot. So you might want to go to someone who's a board-certified plastic surgeon or a board-certified facial plastic surgeon, someone who does this procedure a lot in order to get the best result.
Because it doesn't cost more to go to you, right?
No.
Than just an RN or whatever.
No, it's the same.
So good. Okay, you brought more photos.
Okay.
And for people just tuning in, we're talking about if you're considering any type of facial plastic surgery, what you need to know and what's possible. And with us, we have board-certified facial plastic surgeon, Dr. Machida. Okay, so we're looking at more photos. And also, you've done and I'm trying not to endorse you, but you've done more than 3,000 facelifts.
That's correct, Randy. I've done a fair amount of facelifts in my lifetime. And here's another example of a person. If you look at her carefully, she's got a heavy neck. She's got loose wrinkles on her neck. She's got jowls. She's got lines, look at lines in her cheeks. She has wrinkles on her cheeks. In her case, she even has a heavy upper eyelids and a little bit of swelling in her lower eyelids from fat. And she's got lines in her face. And look at her, especially at her cheeks, she's got a little bit of lack of volume in the front of her face, and that comes from aging. These are all aging.
So is this
age
kind of
changes.
like an ideal patient for you? Like you see this and you go, boy, this is going to be good.
Right. I could see everything that I can do for her, and
Okay.
I know what kind of results she'll have. Here's the after picture. If you look at her after,
My goodness. Totally different.
and if you can see the improvement in her neck, improvement in the jowls, see the lines in her face, much more improved, and we actually filled her cheeks with a little bit of fat to make them have a little more volume. So take a look at the profile. Here's the before and after. You can see the difference in the neck. See how the neck's a lot tighter. There's less muscle bands showing. The face is a lot smoother. There's less wrinkles. See, look at the cheeks. The cheeks show a lot more volume in the cheeks. And under the eyes, there's less of a problem with the swelling under the eyes and the excess skin there. And the lines and wrinkles are all much, much better.
We're going to take a quick break. We come back, more about the process, like what somebody can expect on that consultation. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
I just wanted that shine to be back. And he gave me everything and more. You can't see how I had my blephs done because he's that good. He's that mindful. I finally felt alive again. And it was an amazing feeling. It was like being reborn.
The biggest difference I saw was the disappearance of all the extra skin in the front of my neck. And I was also very pleased that Dr. Machida went the extra mile and did something with the laugh lines along my cheeks and mouth. And I've been very pleased.
Oh my goodness, I look in those pictures, oh Lord, I don't want to see those pictures anymore. I was feeling, oh my goodness, I knew it, that I was different. And I knew I looked good.
I had people approach me a lot easier, like I wasn't as grumpy looking or something, I don't know. I looked better. The best thing is just to be free, feel good, you know, to have a different opinion, a different feeling for yourself.
It's a most wonderful feeling, you know, when they said you look young. Even I'm already, 66. I do a lot of things, I work in everything, and that's why they say they don't believe my age.
When I tell people that I'm 77 and they can't believe I'm that old, you don't look your age, you look at least 10 years younger.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, the keys to a natural-looking facelift. With us, we have Dr. Machida. He has performed over 3,000 facelifts. He is known for natural results. Dr. Machida, welcome back to the program. So what are the keys, then, to a natural-looking facelift?
Well, it's a matter of restoring the natural anatomy of what they had beforehand. They had natural beauty, and when people get older, everything falls. Their face falls, and they get lines and wrinkles. They lose volume. So you have to address each little point in order to make it, it's like a puzzle, putting together a puzzle to make it look just perfect. It's not a matter of just pulling back the face and making it look windblown or stretched. It's all a matter of just doing the right things in the right places.
Looking done, right? I think we've talked about this, that you say that they don't want to look done. Their partners don't want them to do this if they're going to look done.
That's right. That's right. One of the spouses.
You hear that like every day?
Yeah, I hear that all the time, where patients request a natural look. They don't look as if they've had surgery. They don't want people to come to them and say, look at them and say, what have you had done? They want them to say, well, you look refreshed. You look like you had been on vacation. You look like, I love your hair. I love the color of your blouse. It makes you look so much more refreshed and so much more alive. And that's what they want. And that's
Does that ever happen, though, that their friends don't even know that they had it done?
all the time.
Really?
When I do my procedures, they don't look as if they've been done. People think that they've been on
With
vacation.
your necks, because you like doing necks, right?
Right.
But you say that there's different ways to do the neck, and a lot of guys aren't addressing the front of the neck.
It's very important to address that. So the only way to get the neck really smooth and get that nice chiseled look is to be able to tighten the muscles from the front in the middle. And you have to tighten it so that you can get that nice chiseled look. That's the only way you can do it.
But doesn't everybody know that? I mean, every surgeon knows that, so why aren't they all doing it that way?
Well,
Does it take longer?
No,
Is it more technically demanding?
There's some nuances to the technique that just come from experience, being able to be able to handle certain necks. They're all different, and it doesn't quite take the same technique every time.
Okay.
It requires a lot of experience.
All right.
Here's another example of another patient. Okay, so in her case, you can see she's just got some just standard example of aging in her face, some of the wrinkles in her neck, some of the lines in her face, and she wanted to have that freshened up. You can see in the after picture that her neck is a lot nicer. Some of the lines in her face, her jowls are a lot smoother, less heavy, less droopy, and there's a great result there. Randy, put the before and after side by side.
All right.
You can see that that neck now looks about 20 years younger.
That's true.
And if you look in the street, would you be able to tell that she's been done? Could you say that she had surgery?
That's a good
Is that
point.
your first reaction? No, that's not your first
Because I
reaction.
always feel like I could spot a facelift walking down the street. I told you that. You said, not my patient.
Right. And I tried to make the facelifts look very natural, not look as if they've had surgery. So that's obvious to you.
So when it's all done, right, they're healed up, They come in, whenever later. What do they say?
A lot of times they say, "Doctor, I'm really thankful that I found you. I'm really glad that I was here. I think that I didn't expect this kind of result, and I'm shocked and amazed at the result." And one woman, she came in and she said that when she went back to work, she didn't tell any of her coworkers. And one of her coworkers was very verbal. She saw her down the hallway and she screamed so loudly, "Ah!" And the patient, the woman said, be quiet, because I don't want him to know." But she could tell that something looked incredible about her. Look at the profile. This is the telling point here. You can see that.
Oh my goodness.
By looking at the profile. And this is the thing that people don't see themselves in the mirror. They actually see that, people see that other people looking at them from the side. It's incredible.
She looked exhausted in the before.
Right.
Much older on the profile.
Right. She looks tired, she looks older. And on the new profile, she looks a lot younger, more refreshed, it's more natural. It's a lot tighter.
So is that considered a neck lift facelift or a facelift, or is that the same thing?
Well, for me, it's the same thing. I always address both at the same time. I like to do a complete job, and I don't just do one or the other. If they're getting a facelift, I like to address both the neck and the face at the same time.
What's the ideal age somebody should come in if they're considering surgery of any kind?
Well, I'd say the ideal age is probably someone in their late 40s to 50s, because if you look at it this, Randy, if you have a 55-year-old woman, I can make them look 45 pretty easily, and they can stay at that level for a lot longer. 20 years from then, if they had a twin sister that hadn't had it done, you compare the two, there'd be a big difference even then.
So noticeably younger, so it kind of keeps them looking younger.
It keeps them looking younger for a longer period of time, and that's when they can really appreciate and enjoy life, when they're a lot younger. Here's the next patient here. And this one here, I just love these because I knew that she's going to be good. If you look at her neck, there's a lot of lines, there's a lot of looseness. Look at the before and the after, you can see a difference in her neck. It's
gone.
It's incredible. She also had upper eyelids done too at the same time, so her eyelids actually look a little bit brighter. But in her case, her result was incredible. So let's look at the before eyes and the after eyes. You can see that her eyes are a little bit heavy, and the befores and on the afters, just by taking a little bit of skin out.
Just a little bit of the upper skin.
Just a little skin out, and she looks so much younger, so much nicer. Also, there's a little crepiness on her cheeks, on her jaws that was gone just from the facelift too. Everything was addressed there really nicely. If you put them side by side, the after picture looks like it's almost like the daughter of the before picture. That's how big the difference is.
That's true. That's very nice. So do you get cards sometimes, or hugs, or?
Sometimes we get a few things like a kiss or a hug or even a thank you card. It's nice to see those things. And if you could see her other side views, this is another view of her three-quarter view. You can see the jawline's been cleaned up, the neck's been cleaned up. Everything looks a lot brighter about her face. She just looks younger, more excited, more youthful, more refreshed. And Randy, she looks more attractive, more prettier, and she agreed.
That's true.
And of course, here's the next picture of another patient here. If you could see her, if you just look at her neck, you see that her neck has some loose muscle, some loose skin. She has some jowls there on her face. Everything's kind of changing. As she gets older, she looks like she's just hanging more. If you look at the after, everything's tighter, the neck's tighter, the jowls are tighter, and it's a nice natural look. She looks prettier, she looks happier. It could almost look like she became from a mother to a daughter. Same case. And here's an example of standard aging. A lot of wrinkles on the neck, a lot of lines in the neck. If you see the before and the after, you can tell the difference. There's some lines in the neck, some loose muscle, the bands that you can see in the middle of the neck. Also, the jowls are a little heavier. They're pooching out a little bit and showing. And after the surgery, the jawline's been cleaned up. She looks prettier. She looks more natural. She looks more refreshed. The bands are addressed with I could tell at the consult that she needed a standard facelift and neck lift. I knew exactly what I could do for her, and I did it. And look at the profile. You can see that there's a big difference in the profile. That neck looks really sharp, well-defined, youthful. It looks great.
This is great stuff. And these photos are on your website. Is
Yes.
that right?
Yes.
Okay.
Yes.
So final message, somebody watching this, they don't like the way they're aging. Their neck, their jowls, whatever, their eyes, but they're still afraid. They don't want to look done. What do you say to them?
I'd say, come in for a consult. Let me take a look at you, because sometimes you don't need to have a complete facelift. You might need something a little less, or you might need something a little bit more. It just depends. And it's important for you to be evaluated properly. So I'd say coming in.
How much of this is art, if you had to put a percentage on it, and how much is science, your technical skill?
It's both, Randy. You need to have an artistic eye as well as a knowledge and experience of the technique too, as well.
So you've done 3,000, more than 3,000 facelifts.
Over 3,000
So
facelifts.
how much better are you now than you were 2,500 facelifts ago?
I hate to say it, but yes, experience makes a big difference. For people who haven't done a great deal of experience, it actually shows, because you don't know how to deal with certain issues that might come up during the procedure and how to handle it, and that just comes from learning and from experience.
We should mention, which we have not mentioned, that you are doing this under local anesthesia.
Right, right.
Why?
Well, I do this on a local because it's safer, because it's not as dangerous as a general anesthetic, and people don't like to be subjected to things that are unnecessary dangers. So it's safer, but not everyone can do it because you're time limited as to how much time you can take. That's right.
Okay.
That's right, because the surgery has to take a certain amount of time, and if you can't complete the task, then I think sometimes the job might suffer. The actual work.
So you have to be more experienced to do it under local.
That's right.
Is that right?
That's right.
And what about expense? Does it save you any money doing it this way?
In fact, it does, because under a general anesthetic, you have to be done in a hospital or a surgery center. There's a facility fee. Also, there's an anesthesiology fee. So there's two additional fees that you have to take into consideration when you're doing under general anesthesia.
So you're usually less than a lot of the other guys.
Because of that very reason, yes.
Okay, good. I want to thank you for coming on the show. Very interesting.
Thank you, Randy.
Good job.
Pleasure to be here. Thank you.
You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.